committee meeting for Thursday, June 11th, 4 p.m. First on our agenda is a quarterly update on Gray Street shelter operations and outcomes. And I'd like to recognize Sean Lloyd with City Care to present.
Oh, is it? Yeah, it is. Oh, okay, hi everyone, I'm Sean Lloyd. I'm the Chief Programs Officer at City Care, and this is.
Hi, I'm Brittany Kelly, the Director of Homeless Services at City Care.
And thanks for having us. We haven't been here for a little while, so yeah, I think since Q1 maybe. Okay, so what I did is put together some numbers that we can talk through, and I can kind of give you guys some examples of systems that we use to try to plan on how we're going to target helping people kind of cross the threshold into housing. And so some of these first numbers, like our nights of rest, that's a number that there's not a lot of control over, other than it's to show that with an average of 53 people and at just under 8,000 nights of rest, that the shelter's staying at capacity every single day, right? And so that's one of the reasons we like to show what our average is and what our nights of rest is. I think annual point in time was 165, right?
Sure.
Today or this year, yeah. And so we've seen 209 people in the shelter, and that's kind of expected. Last year, I think we almost seen double. Did you raise your hand?
Yeah, the 165, and what's that number again?
Councilmember Bruce, questions need to be recognized by the chair.
Sorry about that.
Councilmember Bruce.
The annual point in time, 165 unique individuals into 2026. What is that again? Does that number represent?
Yeah, so that number is the number that that's the count that came up when everybody went out in the middle of January, and they count and they get kind of a snapshot of exactly what homelessness looks like on one given night.
So they weren't housed.
Well, some of them were right. They weren't housed. Some of them were in shelter. Some of the people are not in shelter either. And so I think the following night was closer to like 240.
So in my mind, I'm thinking, is that 100 people that weren't housed? Is that 95 people that weren't housed for that night? Is that?
Yeah. We actually have those numbers in the point in time count for exactly who was in shelter and who was unsheltered as well. I didn't bring that number with me.
Unsheltered was 73, sheltered was 92.
I figured you were.
And that was a very, very cold winter day.
That's right. Yeah.
It was chilly.
All right.
Okay. So with our housing navigation, so that's one of the things we focus on hard at City Care, and that's one of the things that you guys had allowed us to focus on when we came in to operate at the shelter. And so there's an assessment system called the CHAT here in Norman, and what that is it's kind of an index to rate or to measure how severe someone's experience with homelessness is. And so we performed 85 of those chats this year, and we were able to connect 25 individuals to housing so far for 2026, which our total last year was 28 individuals. So at a little less than half the year, we're already set to hopefully double what we did last year, housing number wise. And so the hard part with that is that, you know, sometimes vouchers go into shortfall or the voucher process stops for a little bit, and that can kind of hinder our ability to help people go into housing. But one of the things that helped us this year get that number bumped up so much better is because we had applied for ESG funds, and we were able to use those ESG funds along with some flex funds to be able to push like first month's rent and some of the documentation gathering that we need to do to help somebody get ready to go into a housing. So self-reported demographics, these are things that are asked at intake in the interview process. And it helps us get an idea of things that people may qualify for or things that we need to start focusing more on as a team to try to see if we can address some of these to help get people in over that housing threshold as well. So we had 97 people report that they were chronically homeless. And so what that means is that they have been homeless for 4 times in the last 3 years, totaling at least 12 months, or they've been homeless for the last 12 months straight. And so 97 is almost half of the people that are staying in shelter are reported chronic. We've had 13 veterans, which is about 6% of the overall shelter population, which I don't know if you guys recall, but last time we were here, we talked about the veteran population being high in Norman for people experiencing homelessness. And so we've put a lot of focus on that. And now that it's down to 6%, it's a little more in line with the trends that are going on in the rest of the country. We had 182 people report mental health disorders. So that's 87% of the shelter. 87% of the people who are staying in shelter are identifying to have mental health disorders. 76 guests have physical disability, so that's about 36%. And you know, in some of the housing options in a lot of cities, there's a couple things you have to prove. Sometimes it's chronic homelessness, sometimes it's proof of disability as well. And so asking these questions kind of helps us figure out what that path is to help somebody connect with the services they need to push forward. So 84 of our guests have experienced domestic violence. That's 40%, so that's almost half as well.
Yes, Councilmember Bruce.
Can you go back to the other slide for a minute?
Yes, sir.
Just trying to wrap my head around this. So if I'm counted 1, but I fit multiple categories, how's that handled?
That's a good question. You can live in multiple categories. So you physically could have a mental health disorder and be a veteran, right? You could be chronic and have a developmental disability. And so you could actually count in more than one range in this. Does that make sense? Okay. Sometimes I talk in circles. I have to make sure people understand what I'm saying. Okay, demographics. I like to throw this slide in so that it gives me a good reminder. We like to look at age and we like to look at race just so we can get a good idea of where a community sits and what systems we need to really work towards to see how we can help people move forward. And so one of the things we like to look at race is, well, I can take, Caucasian versus African American people in the community. I think here in Norman, African Americans make up less than 5% of the total population, but they make up about 30% of what's in the shelter. And that's actually a little lower in Norman than most cities. Most cities, it's about 50%. And so there's also quite a few people that are native that are actually accessing shelter here in Norman as well, which is kind of a high count for the amount of population here in Norman. With the age, what we're seeing is our people that are a little older in age, like 65, 55 to 64, 45 to 54, those numbers have been rising over the years. And so what we're getting more people that are older that have started experiencing homelessness for the first time in their lives. And so some of that population is with the elderly, but our 35 to about 64 is kind of our working age system. And when we go a little bit further and we see like some of the wage counts and some of the insurance counts and some of the things, you're going to see that those are all things that would come with that age group and a wage or some kind of structure in place to pay for life, right? And so what we're learning from that is that, that's not right, sorry. I lost my chain of thought for a second. What we've been learning from that age breakdown, good night. Yeah, we're gonna come back to it. We're gonna come back to it when we get to the other slide. This is monthly income and fair market rent. And so I did talk about this once before. The numbers have changed a little bit. Fair market rent in Norman is about $840 to about $1,050 for a one-bedroom apartment. Rent should be about 30% of someone's income. So someone needs to make about $2,800 monthly to be able to have that minimum wage amount or that minimum amount to pay 30% of fair market rate at $840. So we've got 36 people in Norman who live in the $500 to the $1,000 range that are actually accessing shelter. We've got 15 people from the $1,000 to the $2,000 range that are accessing shelter. We have 7 who receive over $2,000 and 4 who receive like 1 to 500 range, and 136 people with zero income. And so now going back to what I forgot a minute ago, this amazing point I wanted to make is that what we have is we've got a lot of people who are in that working adult age group who either haven't connected to services with Social Security, disability, Social Security, or they haven't had the ability to receive any income at all. Goodness. Sorry, guys.
You're talking about old people when you forgot what you're talking about.
I know, dude. Yeah, it's getting worse and worse, I
How
promise.
they're becoming the largest group that's coming out.
Well, what we're seeing is that we don't have enough work systems in place in Norman. That's where I'm trying to go. I don't know why my mind is skipping around. One of the spots I think we're lacking is as service providers in the community is we do not have work systems. Like in Oklahoma City, we have Goodwill Industries. We've got Work Ready. We've got systems in place for people to go into programs to where they learn some of those skills that they need to get back to that earning income system, or things in place to help people get into disability. We have brought people in that have been working with our people to go towards the disability route. But what we're having trouble with is we're having to transport people up to Oklahoma City to get them into job market programs. That's the big point that I couldn't remember.
I appreciate it.
Yeah.
I have a quick question.
Sure.
too, with the disability, with the current standards for folks, can they earn 2,800 or actually in the 1,000 to 2,000 and still be eligible for disability? I know there's some caps when it comes to disability, and there are reasons why people are maybe underemployed.
Yeah, so if you are on disability, there is some stipulations on how much money you can earn or how many hours you can work. I don't offhand know what those numbers are, but I do know that there are some restrictions on that. I also know that a lot of people who are someone who lives with disability, you know, they make less than $1,000 a month most of the time. A lot of our people who live with disability and they are on SSDI, you know, they've never been able to work a full amount in their lives because they have a disability. And so what that does is later in life, it creates the amount of money that they're able to draw down, or the amount of money that they could possibly have paid into Social Security to come back to them to be at a lower rate.
Appreciate that.
Where is the income coming from? 34 people are on Social Security disability. So that means 34 of our people are probably at a wage where the only way they're going to be able to go into housing is with a subsidy. And the hard part is we're in a system where we get good parts of the year where vouchers are flowing and we're getting people moved into units, but then they come into a shortfall and then they cease for a while. And then we have to get really creative on ways to get people into housing. Social Security income, so that would be people who are retirement age, and we're at 33. And what I did is I included retirement Social Security in that number as well, because we've actually only have 3 people who worked enough and paid in enough to Social Security that they would actually receive a higher amount of Social Security back at the retirement age. Earned income, we have 11 people working right now, and so a lot of times we can get with the people who have earned income, and we can use those ESG funds or those flex funds or some of those systems that are in place to kind of help prop them up quicker into housing because they're going to be able to sustain with earned income. We have one person who's on a pension. Health insurance. So, you know, if you're one who experiences mental health or you have physical disability, it's imperative that you have health insurance or that you're at least receiving sooner care or some kind of government provided health system. So we've got 72 guests who are uninsured. And so there's enrollment periods where we have people come in from the different service providers and try to get as many people as we can enrolled into health benefits. But as the year goes on, you know, people are coming in and sometimes we can get them special permissions to be able to go ahead and get signed up for health insurance, and sometimes we can't. We've got 45 people with state-sponsored Medicaid. That's about 22% of the population, and 40% on Medicare. 40 people, which is 19%. So what that's saying is that 40 of the people are of age to receive Medicare, but there's a pretty good chance that they're on a fixed income. We've got 5 Native Americans out of the 17 who are actually utilizing the benefits. So that could be because one, maybe they're not on record and they can't receive benefits, or 2, for some reason they choose not to receive benefits, or 3, maybe they've never been connected to benefits. So case management, this is advocacy. I like to put this slide so you can just kind of get an example of things that a person's doing every day as like a case manager or a housing navigator. And so with advocacy, what that means is you're physically doing the process. That means you're making the phone call, you're setting the appointment, you're helping somebody with an online search. You're actually doing the things that you have to do to work through a referral, right? And so the amount of people that our advocates are pushing into or doing the work for disability, Social Security, that's usually people that have already started receiving that. And for some reason they need help, like maybe they've stopped receiving benefits, or maybe they need to change an address, or maybe they need to change some of the things that are in the system for them to continue to be able to receive their income. And so these just give examples. If you look in the middle, housing, that's where our navigators and advocates are focusing a lot of time. So that's calls to landlords, that's calls to Norman Housing Authority, that's putting somebody in your car and transporting them over to fill out paperwork, that's filling out referrals or applications is what I'm looking for. And now the referral is actually the thing that you're doing. So with a referral, that means like if we've referred 34 people for housing in the last quarter, what that means is we've actually taken 34 people, made the appointment, and gotten them somewhere to work on that step for housing. Mental health services, we do a lot of referrals to mental health services, but it's actually kind of getting a little more tough in Norman for mental health service. There's been some changes that have happened over the past, year and a half, I guess.
Yes, Councilmember Bruce.
Sorry, I didn't mean to interrupt.
No, you're great, yeah.
That's just really surprising, mental health. I mean, to me, that would be your biggest load.
You're absolutely right, because when you look at the amount of people who are identifying mental health, right, that's a great thing to point out, because that's how we use these numbers to try to target certain things in the shelter. The hard part with mental health is just because somebody identifies as mental health and we want to do the advocacy work to make the referral, it doesn't mean that they're going to see the referral through.
Is it because there's no one on the other side to grab the referral?
Sometimes, yes. It's actually a whole slew of things. It's not any one thing, right? It's a lot of things. Sometimes they were receiving mental health services in the past, or a lot of them are actually already hooked up with mental health services. So if they're already receiving mental health services, we're not going to make another referral to another mental health provider. And so a lot of our people are already accessing service. And there's some people in this room that could probably tell you more about that. Length of stay. So one of the things we like to look at and track is the amount of time somebody's spending in shelter. And so the numbers here in Norman are actually, people stay a little bit longer here in shelter than they do in other cities. And so in Oklahoma City, I can tell you, almost half of our population that sees shelter is gone in less than 5 days. And so that's 34% here, which is quite a bit lower. And so normally in Oklahoma City, as you go down, and in Tulsa as well, as you go down to longer lengths of stay, the numbers usually go down lower with the longer amounts of stay. But what I've noticed here in Norman is that as you get kind of to that middle rate to about a month, the number actually, it goes up, which is not common. But what I think that says is it says that that we're bottlenecking at the shelter stage, right? And you guys know this stuff. Like I'm not telling you guys anything that's like, oh, this is new. We bottleneck at the shelter stage, and the hope and plan is that we do expand shelter more, which will be helpful. But the truth is what we need is more low-income affordable housing. Not just affordable housing, we need low-income affordable housing. And so if we can open up avenues and doors and places for people to kind of move out of that shelter system into a more stable, longer-term situation, then we can reduce that bottleneck, and then we can get the numbers down to where in less than a week someone may self-resolve, or we may already have placement for them.
Yes, Mayor Holman?
And just to be clear, so the vast majority of people though are staying less than 30 days. It looks like. Am I reading that right?
No,
The
yeah,
vast majority are staying 1 to 5 days,
that's right.
and the vast majority are a month.
Yes,
But there are a higher number of individuals that are staying longer than that.
that's absolutely right.
And then 4 that have stayed about a year.
Yes.
Or wait,
No,
4%, 21
4%,
total
yeah.
individuals
Yeah.
that have stayed a year.
You know, it's funny, I almost put percent signs down that, and then I was like, nah, it's fine. Yeah, maybe.
And then the bottleneck being housing vouchers sometimes being an issue. And then even if there are vouchers, there may not be any place
That's right.
to use them.
You know,
And
also,
so getting people out of the shelter, there's where are we getting them
Right.
out to?
you know, when we first started the operation here in Norman, you know, we didn't have access to ESG, and we didn't have access to some of the funds that we need to get unique or creative with ways to house. And so as we've been able to start to integrate that stuff into the shelter system, it's really opened a lot of doors for us to be able to do that and to actually, I mean, we're you know, we're not even through the second quarter, and we're about to bust our numbers for the entire year last year on housing, so.
I do have a question to tack on to that. So for the people who are staying longer days, are we talking chronically unhoused, people who are gonna need permanent supportive housing to actually be available to move out?
I'll say this, most of our people who are long-term stayers here in Norman are elderly. And so some of them are kind of at an age where there's only a few choices. One may be going into maybe extended care, like nursing care type places, and they're not ready to take that step, or two, they're just not in a place where they're healthy enough to take care of themselves. And so that's where we get most of our long-term stayers here.
Thank you for the added insight.
Updates, everybody knows, I'm just gonna kick it out there. We had an interruption of service, sort of. We really didn't have much of an interruption of service. You know, that was on Monday, June 8th. And normally I try to focus this back, but I just wanted to get this out of the way now. So, you know, we did have a situation, there needed to be some renovations. They're happening so fast, guys, it's amazing. Like, Lance's team is doing a great job over there. But Michael East at First Presbyterian, he said yes instantly, right? And so Lee McWhorter, Amanda Scherf right here, like, we were all able to just jump in, and some city care team members, and make a couple of calls. And, you know, in 3 hours, we were able to pop a shelter up somewhere to where we didn't have to lose service. And, you know, within another hour from that, meals were coming, and people just stepped right in. I'm not gonna forget Lee Hall over here. She always has her hands in everything that we seem to pull off quickly. It goes a little slower if Lee's not involved. And so I want to thank everybody for helping with that. Like it was actually amazing. I think we were able to possibly build some relationships with some other churches too that are going to help us talk through winter planning and maybe go into this winter with a little better system in place so that we don't walk into an emergency. You know, I've said this before and I say it a lot. Like winter, everybody calls it an emergency, but it's not, right? We all know winter's coming. We all know it's going to be freezing. We all know people are going to die. If we don't plan a system to keep people safe, we're just poor at planning.
I do have a question about that interruption of services.
Yes,
So
I may be able to answer it.
how goes it with the state? Was a surprise inspection?
That's a great question. I'm not sure. We are operators, so when the call came for the building, it comes to the city. It's the city's building. You know, I received a call that we had to make some renovations, and so we quickly gathered the crew and started doing what we needed to do to make sure people had some safety.
And is there an estimate on the cost of those renovations yet?
I do not have that information. I just know that we are supposed to be able to enter tomorrow.
Okay.
Yeah.
Thank you.
Yeah.
Councilmember Gandes.
And also to that point, the renovations should have a phase 1 and a phase 2, so it'd be like 2 different budgets, pretty much that on those phases.
Yeah, and from what I understand, there's a list of things that we have to do to be compliant enough for it to be safe. And those things are happening, like, they're wrapping up as we speak. And there may be another list of things that have to be planned out on a longer term situation or scenario. 25 people, like I said earlier, connected to housing in 2026. The total for 2025 was 28. Our housing navigation team is, they're really good at their jobs. And we've got some people that are really, really good at creating relationship and then becoming long-lasting relationship. And so we've been able to develop a couple of really cool relationships with some of the apartment complexes here in Norman. And being able to have access to those ESG funds has created us the ability to make better arrangements with some of those landlords. Housing vouchers are on a freeze, I think, right now, and they'll probably open up again soon. But you know, that's unfortunately one of those things that nobody has any control over, right? Because the truth is the need is much greater than the resource every single day, and so that's a situation that's at no fault of anyone's other than the resource just isn't great. Yeah, I'm not gonna say it.
I will. Yeah. No, there is an entity that could make it easier for all of us right now. So, but when you say you think they might open up, is there an expected disbursement from?
That was hope. That was a hope.
A hope.
Comment.
Gotcha.
No, I'm just kidding. I don't have an estimated date. I can maybe get that, but I don't have it today.
From Housing Authority?
Mhm.
They're not technically on a freeze, they just
Oh, they're
only
not.
have 1 or 2 vouchers coming open a month, so it's an
Okay.
effective freeze. They're worried about shortfall at the end of the year, so, and for those of you who don't know, shortfall, they have to estimate what they have already committed to paying out in rent for the vouchers people are on. And because rents can go up at any time during the year, they have to leave a buffer to make sure that come December, they will actually be able to pay the rents of those that they have already been paying. So they become very, very conservative about releasing vouchers to more people because they're increasing the chance that in December that they will run out of money. So the difference between Norman Housing Authority and Oklahoma City's Housing Authority and OFA is they've opened our waiting list back up. Oklahoma City and OFA were in shortfall and closed their waiting lists. Norman was in shortfall last year, closed their waiting list. They opened their waiting list back up and have released some vouchers this year.
Yeah, the waiting list has been functioning. We've gotten a lot of people signed up for vouchers. We've actually had a lot of people pull vouchers this year, which has been quite helpful. We've also had quite a bit of luck getting those vouchers filled as well.
Good.
Councilmember Bruce?
You may have said it, I just didn't catch it. So in the line which says 25 people connected housing in 2026.
Mhm.
In my mind, I'm thinking, well, this is not a fair comparison, meaning for you, because did you normalize the data? What I mean by that is, you're only halfway through the year,
Yeah.
25 people.
Yeah.
All of last year, in my mind, you had 28.
Mhm.
So you're halfway through. So you're well ahead of.
Yeah. Yeah, that's exactly the point I wanted to get across is with us having access to be able to get some of those ESG dollars and some of the flex fund systems that existed here in Norman already and weave those into the navigation system that we use. That's allowed us the privilege of getting to almost beat that number in half the time it took last year. And that would also be in relation to those built relationships with the providers, apartment providers as well.
So I guess your stretch goal is 50 for the year.
Yeah, I think our stretch goal was 40, but we would love to hit 50.
As many as you can get.
Yeah, that's
the
right.
number is.
Yeah, and that's, that's
If those vouchers open them. So if
right. But
those
also,
vouchers open up, it could help you drastically.
yeah, it would help drastically, but also the units available and landlords willing to work with those vouchers as well. And so Norman's Housing Authority has a guy that does that year round. And so they've actually built quite a bit of relationship that didn't exist prior to that role. And so we also spend a lot of time developing a relationship and so ESG dollars, you guys have heard me say that. That's emergency service grant dollars. It's a federal dollar. We directly use that for 12 people to pay almost $2,500 a person to get all the things wrapped up that we needed to do to get somebody into housing. And so just by being able to apply and receive those dollars, it really helped push 12 of the 25 people over the threshold of receiving long-term housing. And so that pays application fees, it pays deposits, it pays utility deposits like rental arrears, and it pays for some of the case management work that comes with helping those people remain housed.
I do have a question about people getting into housing and then how long are they staying housed? Are you seeing people come back through the shelter system because they weren't able to maintain it? Or is case management following them along in their journey?
That's a great question. We need more case management following along in journeys. I don't have the number today with how many people, I'm just gonna say recidivism rates or recidivized, because I didn't think to bring that. We can pull that out of HMIS, but the hard part is outside of us, other programs are using HMIS, but they're not utilizing it to the full strengths of the system. And I know that's one of the things that Amanda and them were focusing on. And so I think as we kind of progress through the year and go into next year, I think some of those things with Amanda leading the way are going to start to materialize so we can get a really good idea of how many people are crossing services, right? How many people are receiving all their meals at food and shelter, how many people are spending nights with City Care. If it was an ideal world, we could find out how many people were accessing rides at caravans. Like if we can get all of that data, then we can start to really focus in on the spots that we know are pain points or slowdown points or bottlenecks and try to really push more people into the housing realm. But as we do that, we have to develop more case managers because permanent supportive housing there's not a lot of permanent supportive housing in Norman. There's not a lot of extended case management for people after they go into the housing market here.
Councilmember Bruce?
So what's your recommendation on how to do that? In my mind, it jumps out. Like,
Yeah, that's a good question. I think developing really good data, doing a really good job with becoming competitive in the national market to receive federal dollars to come in and supply some of those systems. I know Heidi works really hard at looking for every system and dollar that she can get to come into the COC system. But I also think it's gonna have to come from private donation. It's gonna have to come from government on multiple levels, you know, city, possibly state, federal government. It's gonna have to come in from maybe some foundation dollars. We're just gonna have to be able to weave everything from a community together to get enough funding in place to kind of to set the stage on what is expected in Norman for long-term care.
And speaking of multiple levels of government, in Oklahoma City, does City Care get any funding or assistance from Oklahoma County?
Does who?
City Care get any assistance from Oklahoma County?
I don't think so. I don't want to lie to you because I'm not
We'll find
100%
out. Well,
sure.
it's like a question to chase down. But,
Okay.
we've recognized that there are multiple levels of government that could be working on this.
That's right, yeah. Yeah, that's absolutely right. I don't know that we receive county dollars. There might be some one-off things here and there, you know, that the county might have studied or wanted to know, but for the most part, most of our funding is federal, except the money that comes through the city from the MAPS projects, which actually funds our entire Key to Home system, which is very robust.
Okay. Well, we are coming up on a Norman Ford question in the future. Councilmember Gandisberry?
I'd also like to say, you know, for your numbers and stuff like that also, you know, three of the ladies behind you, we all know what they do and how they've been rock stars, even in a short amount of time that they've been with us all, you know, a couple of them and everything like that.
I lean on them every day.
But as a city care, we can't take that for granted and need to get them help, because if they hit burnout or go somewhere else, we go back a couple of years now, you know what I'm saying?
Yeah.
And what we're doing and everything like that. So we gotta make sure we give a support structure to actually make that solid there and everything, where they're trending the next succession up, you know, and everything.
The good news is that you guys do have experts. You know, they're experts in their field. They do a good job. I will say too that I think that some focus on diversion from shelter might help with that bottleneck as well. If you guys are looking at the Norman Forward vote, if we could possibly get some funding in place that would reach like those 11 people that we've seen that are that have earned income, right? Like if we could get a system to where as soon as they're coming into the shelter, they're automatically going to diversion, and then we're instantly, I mean, in days, popping them back into another apartment or another place. And a lot of times, the shorter amount of time that someone actually spends experiencing homelessness, the more likely they are to maintain long-term housing.
100%.
And so that's also one of the reasons I like to show those lengths to stay, is because once we cross that threshold, then the likelihood of that person remaining long-term homelessness or long-term homeless is much, much greater.
And I was gonna say, this presentation will be available online through, I'm gonna look at Tiffany, through the unhoused and sheltered information. So if any of us wanna take a look at this, we just hit up that page.
Actually, as soon as I get up in 5 seconds, this thing's gonna explode.
Okay. Well, thank you for your time, and if
I'm
you
a
have
spy.
questions, I recommend y'all reach out to Sean at
Thank you very much, Sean. Appreciate
citycareokc.org.
y'all.
Thank you.
Appreciate y'all very much.
All right. Next on the agenda is an update from the City of Norman's Community Services Manager, and I'm gonna recognize Amanda Sheriff to talk.
Alright, hi everybody. I think I've met most of you guys now, but my name is Amanda. I'm the new Community Services Manager here with the City of Norman. And I'm just gonna give a little overview of who our department is, what we're working on, what we hope to work towards, and what we've accomplished in about a month's span. So like I said, I'm Amanda. Kara is our community outreach social worker sitting behind me. Both Kara and I have worked in the field of mental health and housing for a combined of 13 years. I think Kara's on year 5, I'm on year 8. Kara started in mid-April and I started the first week of May with the city of Norman. For Kara's role as the community outreach social worker, she's the one that's like boots on the ground, basically. She's the one making contact with those in our community who are experiencing homelessness. She's working directly with that population, providing some case management services, some peer recovery support specialist services. She's certified in both of those through the Department of Mental Health. She's helping facilitate referrals, warm handoffs, follow-ups, advocacy, assessments, de-escalation, and much, much more. My role here as a community services manager is working on a lot of coordination efforts within the city of Norman related to anything homelessness, substance use, mental health, and just to be a liaison to community partners, community members, the business community, also looking at managing contracts, managing budgets, and then also developing strategies that are evidence-based best practices to address homelessness, substance use, and mental health concerns. Kind of the big overview of what we're doing is just trying to help coordinate those efforts within the city of Norman. Like I said, those agencies that work closely with the population, business community, the neighborhoods, and this is funded with opioid settlement money. So we do have to tie in, obviously, the substance use into that due to the framework of the funding. Let's see, what else do I have here? A couple things that we have worked on so far is developing what we want our department to look like and how it should operate. So we're just still, like I said, in the very beginning stages of that, working on some policies. Another thing that we've been working on is either establishing or for me, reestablishing, because I haven't worked in the Norman community in about a year, just some of those community partnerships with agencies outside of the city of Norman, and then working on outreach efforts too. So that involves assisting the police department, the action center, making sure that we're addressing the concerns that the community is bringing forward. And then a big thing, as you guys all know, is working on the encampments that have been in our community over the past month. Speaking of encampments, just a little update for about the past month on the encampments. So when I first started here, like I said, in the beginning of May, the Francis Kate Park encampment was kind of the big topic at that time. Kara was doing daily outreach out at the encampment along with the police department and Central Oklahoma Community Mental Health Center. We were out there trying to establish some referrals, do some wellness checks, provide transportation, just anything that population was needing to try to get out of that situation as quickly as possible. As you can see on the PowerPoint, we don't have an exact number that was out there, but it was around 45 to 50 people at the highest level from what we were seeing. Next is the Operation Safe that occurred towards the end of May. We were not notified about that, so we were not out there that day that occurred. But from what we've heard, it was maybe about 20 people or so. So now no outreach occurred during that time, and obviously they had dispersed due to that. And then the last big one that we just worked was the river encampment. That was towards the end of May and into June. So we were made aware, I think it was on May 26th, it was right after Memorial Day, about the landowner wanting to clear the land for development. So we did outreach efforts every day, both Kara and myself, along with PD. We also went out with Central Oklahoma Community Mental Health Center and their outreach team. And then we also had SSVF come out. That's an agency that works with veterans. One of their workers came out with us too one day just to provide some outreach efforts, make folks aware that, you know, they were going to have to clear. They did have about 6 days notice, I think, 6 or 7 days notice, to be able to leave before potentially getting ticketed or eventually going to jail if they were not leaving. Like I said, with the outreach efforts, trying to provide some referrals if possible, giving out at least our phone numbers. That way, if they weren't ready for something, they had a contact to be able to reach out to for when they were ready. Providing some transportation assistance with trying to find resources and much more. Some statistics for May. I will be honest with you guys, these numbers are not going to be 100% accurate because we didn't really start tracking some stuff due to the encampment issues. I know the number for sure that is 100% accurate is the Action Center inquiries. So that we had 25 that were related to homelessness in the month of May. The number of unhoused contacts, and this is the unduplicated number, is about 73. I'm gonna guess that number is a little bit higher than that, just based on the encampments and stuff, especially down at the river, because there were about 60 people down there. The number of transports to treatment, so Kara will provide transportation for folks that are interested in either mental health or substance use treatment. That could be inpatient, outpatient, detox, rehab, whatever that may be. There was about 3 of them there, and my guess is, again, it's probably a little higher because that's not something we were necessarily tracking when I first got here. Yes.
And I totally acknowledge that your department is new.
Yeah.
And you guys have not been doing this very long, and I appreciate the quick ability to like get in there and start working. With the mental health and substance use and the transport to treatment, I know we just appropriated money to make that a mobile office. And so with that upgrade on that van, do we think that will help assist people into making that next step? Because it is their choice to go into mental health services or substance, or, you know, like a rehab.
Yeah, I think it could assist for sure on getting folks, again, it's their choice though on if they want to do that. And I know for sure Kara took one person to detox, and again, that was that person's choice to be able to do that.
And when, and this question might be for Kara, but when that contact was made and that transport was made, was the van used or was it like a regular vehicle?
It was a city vehicle.
It's a city vehicle.
Okay. I have been privy to mental health services coming out to address somebody whose house was not fit to host mental health workers, and the assessment had to happen on the porch, and they came out in a 4-door sedan, so that wasn't a good place to do that. So I'm very hopeful with that van being upgraded for office like assessment, that will aid in somebody making that next step.
Yeah, absolutely.
Councilmember Gandisberry.
I'd also like to point out that Norman PD on their weekly overview that they send out and make public also, they have a spot on there where they keep number of their transports, mental health and substance use also and everything, just in case anybody's look at the whole, wants to see the whole picture and everything like that also to help and everything as well. Because there's some that we don't want y'all to have to transport.
Yeah, absolutely. And then the last number is the number of referrals made. Again, I still think this number is probably higher than what we're showing right now. And referrals could be made to, you know, inpatient, outpatient services, getting insurance, clothing, like diversion hub. What was that? Yeah, housing, going to Social Security, anything like that. So, like I said, it's about 15 is what we have for this month, but I'm hopeful we will have better numbers starting in May, now that we know exactly what we want to track.
Yes, Mayor Holman.
So the Action Center inquiries, that's residents of Norman citywide that called in May, called City Hall.
Yep.
Called the Action Center with concern about something to do with homelessness.
Yes, yeah. So, and a lot of them were encampment related, or parks related. And typically whenever we get one, Kara goes out pretty quickly, typically within that day or even within a couple hours of us receiving that, and she'll go and check, and we have a solution for whatever the inquiry was, or at least an update on what it is. So,
Okay, so that's an option for residents to call and
Yes.
we'll get it going.
yeah.
And then the department part, so you're under a department or this,
We're under the city manager's office.
in the city manager's office.
Mhm.
So that's what I wanted to clarify
Mhm.
for the record. There was,
Yeah.
okay, perfect.
Yeah, I think because homelessness touches every department within the city of Norman, that it made sense to have it under the city manager's office. That way we can coordinate efforts a little bit better because of that. Community partnerships, like I said earlier, May was kind of a month of us just kind of getting settled into this new program, and either making connections or reestablishing connections. Throughout the month of May, we were able to connect with 6 agencies that are outside of our regular contact. Just as an example of some of those agencies, was APS, Volunteers of America, Period OKC, the Cleveland County Disability Coalition, the OU Southwest Prevention Center, and then the Oklahoma City homeless programs. So these contacts are hopefully going to start formulating some better partnerships for the city of Norman. I think one of the ones that we are most excited about is with the city of Oklahoma City, because they do have, kind of similar to us now, they do have a program specifically geared towards homelessness, and they've had that for quite some time. So we're meeting with them later this month to kind of pick their brains, see how they started their programs, just to try to get some ideas and maybe partner together to see how we can try to reduce these numbers that we're seeing. Another partnership that I would like to point out, and Sean already kind of touched on it a little bit, is just the current shelter situation too. So like Sean said, on Monday, we received notice that we needed to vacate the current building. So once we learned about that, our staff, along with Lee McWhorter from the police department, we started making some phone calls, and we were able to actually find 2 locations that were willing to be a temporary solution for the shelter, all within the span of literally like 2 to 3 hours. It happened very quickly, which I'm very grateful for. But I will say that was not possible without the connection with the Home Together Norman group, like Lee Hall being one of those folks there, because they put in a lot of work within the faith-based community, and because of that, it has opened up a lot of possibilities for pop-up shelters to happen in those weather situations or for a situation like this. So really grateful for those community partnerships and for us being allowed to do the work that we can do to make that happen. Just some tentative next steps that we would like to accomplish here is just kind of start documenting our operating procedures. Again, trying to get those policies in place and all of that. It was a busy first month here for both of us, that we haven't really had the time to sit down and do that. Also update the website that Councilmember Grant just mentioned. We've already had a meeting to discuss that and just kind of revamp it a little bit. That way it still has some of the historical data on there, but also just some more current stuff too. We want to continue establishing partnerships with community partners as well, because you can't do this work by yourself. It takes a village to make it happen, and we definitely want to be a part of that village and get more folks into it to be able to help us. Also would love to start scheduling some meetings with either community groups, neighborhood groups, the business community, start providing some education related to homelessness and give them a point of contact if they are struggling with somebody who might be unhoused or using substances. That way, maybe we could divert some calls from PD over to us. modify our like little mobile crisis vehicle for as a traveling office for Kara for those situations. I think a good example of her being able to use that would have been today over at Central Oklahoma. They had the Be Heard movement out there, providing showers and laundry services for the unhoused. And instead of setting up a table in really hot weather and windy, like it would have been nice to maybe have this vehicle there where she can kind of office out of it and be able to help folks. And then the last step is maybe hiring a intern, because we do have some funds for that, either bachelor's or master's level. That way Kara kind of has a little partner out there in the community, just so they can learn what is, especially bachelor's level. Oftentimes, especially if you're a psychology student, that was me many years ago, but you get told that you can't do anything in this field without a master's degree, and that's not true. There's plenty of bachelor's level work out in the field, and some of it is what Kara is doing. So just having somebody out there with her, that way they can learn from somebody who's doing it really well, but also to have her have somebody out there for safety reasons, obviously, too. It's never great going into an encampment just by yourself. It's always ideal to have two people there. So
I was gonna ask if there were sometimes it was a co-response depending on the type of call, or if Kara is having to go out by herself 100% of the time.
It just kind of depends, honestly. Sometimes it is co-response, either with PD, like if they get a call, they'll call her and say, hey, we really need you to come out and help with this, and she'll make it happen. Sometimes it could be by herself if it's an action center inquiry and it's somebody in a park, like one person, she may go by and check and see. Sometimes it is partnering with Central Oklahoma as well, because they do have an outreach worker, but those are our only two outreach workers in the community. So again, to kind of echo what Sean said, we need more people in this community to be able to help assist with this.
And I don't know if this is a question for you or maybe Heidi, but is there an estimate on the needed number of caseworkers and outreach workers?
You can get.
Yeah, as many as I could get, I would love that. I don't have necessarily a number unless you do, Heidi.
That is so beyond the scope
Yeah.
of what, I mean, you could make the number 50 and you could fill the need. But that's such a hard number because most are not hired by their city, most are hired by agencies. And as the continuum of care, we have no directive to tell an agency you even have to have someone who you can call a case manager. Many of the agencies that are operating through the COC do not do traditional case management and do not have case managers. So I would say if in the fantasy world where funding is not an issue, I would say a city our size should easily have a staff of 20 to 25 because as Dan Strawn says, for those who are chronically homeless, a caseload of 20 is a lot. I know COCMHC's caseload was 120.
Under 200 is what they like it to be. It's around 180. There's 5 teams. There should be 2 CMs on each team. Right now they're down to 7. And so sometimes when there is, attrition, then people also have to be reassigned. So just for COC, I know that they are down and needing help.
Yeah, it's hard to do good case management when your caseload is really, if it's over 20, in my opinion. If you really want to be intentional and see progress be made, it needs to be under 20. And like Sean said earlier, and I think Councilmember Bruce had asked about the pick count question, the day after the pick count, I think the number was like 238 people experiencing homelessness. And again, we don't have enough case managers for that. We don't have enough peers in the community for that. If we really want to see solutions happen, it's going to take having more case managers or peers. And again, neither Heidi nor I can force agencies to have that. It takes funding to be able to have that happen. And there's a lack of funding for all nonprofits in our community, all state agencies in our community. It's also going to take, like Sean and Brittany were saying earlier, it's also going to take some diversion money or some prevention money as well. A lot of times homelessness can be prevented if there was some prevention money. Somebody may just be 1 month behind, maybe $800 or whatever that may be, but you might be able to get $25 here and $25 here from a couple churches, but that's not $800, that's $50, and you're still gonna lose your housing.
Does Kita Home provide those?
Kita Home's just in Oklahoma City.
Well, I was kind of curious, are they getting that diversion and assistance money,
Yes.
through MAPS, essentially to help people from showing up at the shelter in the first place?
I don't know exactly where their funding comes from for Kita Home. I'm sure some of it is MAPS and some of it's probably HUD funded is my guess. But yes, they do have those things.
And you'll be talking to them this month.
Yeah, well, we'll be talking to the city of Oklahoma City, not Kita Home. They have a staff kind of similar to us. I think it's more staff members than what we have of just the two of us, but they have a homeless programs coordinator who I think does work very closely with Kita Home. But that's who we're meeting with to start out with.
Okay.
Kita Home,
Diversion is a function of resourcing.
Mhm.
So Kita Home is not necessarily diversion. Diversion is you hit people before they are actually into the homelessness systems of care. So anybody who got to Kita Home would not have been diverted, but like Oklahoma City has a whole system of resources that they can do before people actually enter their homelessness system. The only diversion resource we have in Norman right now is veteran services. They're the only ones that have pots of money that you could maybe find somebody same day and get them into a hotel room. There are not any other, like our by name list and how our coordinated case management works radically different than Oklahoma City, just based on the resourcing that we have.
Appreciate that added info.
Yeah.
Are there any other questions on?
yeah, that was the end of my.
Councilmember Bruce?
I mean, it's a tough job.
Mhm.
So when I think about standing up new organizations, or sub-organizations and organizations, I always like to think about what systems are running the systems. Just, once you understand the systems, if there are systems in place. If not, when do you need to get those systems in place? But understanding the service lines that are provided, who provides those service lines? And what's the demand on those service lines? And there's my gap that I gotta let people know about. Not only in the community, hey, I've got a gap, can anyone do this? And this big gap, in my mind, I'm thinking, oh, there's a big gap related to case management.
Mhm.
And if you're in the non-for-profit business, why wouldn't you start up a case management? Hey, that's what I specialize in, that's what I do. Does that make sense?
Mhm.
So having that site picture, that aggregate site picture, when it relates to services, I'm blind. I just don't know.
Yeah.
And I don't know if you guys know besides gut feel.
Yeah.
Does that make sense?
Yeah, I mean, again, like Heidi said, there are several agencies within the continuum of care that do offer case management. It's not the traditional case management, but it's case management. They may or may not be certified through the department. But again, it's a funding thing too. Like, just because we have a need for it, I can't go to one agency and say like, hey, we need 20 more case managers. You guys need to provide it. Where's that funding gonna come from? Because you gotta pay them. So where is that going to come from? And everybody's pulling from the same pots. There's not much funding out there for this.
So there's very little pro bono work with
Yes.
case management.
Yeah. This field is very understaffed and underpaid, for sure.
And if I could interject too, the burnout and
Yes.
attrition
Yeah,
of
the high
workers.
case loads creates a lot of burnout. Again, I've worked both small nonprofit and I've worked CCBHC, which is what Central Oklahoma Community Mental Health Center is. High case loads equals high burnout. When you're dealing with 180 caseload with the agency that I was at, we maxed out at about 120 to 150. It just kind of depended. Turnover's real high. It is real high because you're just seeing clients back to back to back all day. And it's hard, again, to provide good resources when you're stuck like that. And it's not a knock to any agency or anything, it's just how the system is right now.
I get it. I guess I get the environment. It's quite a load that you have just getting that site picture.
Yeah.
For all the service lines that are needed related to providing assistance
Mhm.
in the aggregate.
Yep.
And if you don't have the systems in place, it's, you know, it's a gut feel.
Absolutely.
Mayor Holman?
Yeah, just to say, this is the type of thing that I would like for the state and federal government to spend our taxes on. The state touts having a budget surplus, the governor does, and their discussion automatically goes to how can we cut taxes for corporations and the wealthiest earners in the state, while there's all these problems that we have and underfunding social services, and we can't get enough people to do it because we can't pay them. And this is what we're talking about, at least from my perspective, when we say we need the state to do something. The city of Norman can't
Hire 20.
fund social services statewide and social workers to deal with this. But the state can. The state has a multi-billion-dollar surplus, from what I understand. So much that they feel comfortable cutting revenue drastically to the state coffers. So, and then the federal government, of course, spends billions and billions, trillions of dollars on all sorts of things. So that don't benefit all of us. And so, I don't know, just a message out there to state representatives. Again, this is the type of stuff I want my tax dollars to go to. So, and thank you for all your work.
Yeah.
I'm really excited to have this working for the city, and the ability for residents to call the action center and get, action taken, at least to investigate what's going on with an encampment or with a person who may just need help getting connected to city care or to some other service. So I think this is a big step for us to have this. So I'm excited that I think it's going to really help us make some progress with getting people out of this situation. That's the main goal, is how can we get people out of this situation as fast as possible? Sean was mentioning that, that the longer people are in this situation, the more likely they're going to potentially develop issues health-wise, mental health-wise, also addiction potentially, but also going to be much harder to get them out of the situation. So that's the main goal, is how can we get people out of the shelter as fast as possible into whatever services they need to be supportive. And then how can we prevent people who are not homeless from becoming homeless through housing policy and initiatives that other cities are having success with when it comes to that type of thing. So anyway.
Yeah, and like Sean said too, I think more affordable housing in Norman. Again, I worked in Norman for almost 7 years, and you have 120 days technically with a housing voucher, and you use up every bit of that 120 days. Sometimes you need more than that, because it is truly hard to find housing when you're using a subsidy. There's not enough landlords out there, and I mean, I get it, like Norman is growing, we're in the SEC now, all of those things, we're seeing these big, beautiful, giant apartment complexes coming up, and I use beautiful loosely, but it's taking away the affordable housing for a very vulnerable population that Norman has and will always have. The affordability is never gonna go away for it, so we need some of that more low-income housing for sure.
Councilmember Gandisberry?
Kind of go along with Mayor's comments that he made and everything. The thing I like about the city of Norman finally having our own case management, and answering that action center line is with the mental health clients that we all serve and help and everything in our town. The more that those individuals see the same people coming out there, that's when they finally say, yes, I'll take it, because they finally can trust you, feel like you really care and things like that. And I think the more that this just can grow and roll along and everything, that one of them's going to tell another one, hey, no, you need to trust her, or she'll help you, and stuff. And that's how this can get going pretty quick and everything, hopefully.
Yeah, and I think we're really lucky, honestly, to have Kara with us, because Kara has been doing this for a long time at Central Oklahoma, and she's worked in shelter, she's worked inpatient. Truly, there's no better person to have for the city of Norman than Kara Fritz. They already all know her. They know her by name, or they know her by her hair color. Yep. So, yeah, we truly have the best person for the outreach here in the city.
I don't know, I was gonna say, I'm glad she's not burned out.
Yes, me too.
The other thing I was gonna ask about, cause y'all are new and, you know, I imagine doing this quarterly with y'all as well, so you have the ability to, you know, have 3 months of data to present and
Sure.
give us trends or highlight what we might expect in the future. The only thing that I would ask in the record keeping to break out would be mental health calls that aren't necessarily homeless. The reason we have those vans, one is a day labor van and does do, there's case management, can help with mental health, but it truly isn't what people were asking us for when those vans had the money appropriated and were purchased. Really doing the modification to make it a mobile office is truer to the intent of what the community imagined. And I've been telling people, yes, this is funded by opioid abatement money, but the benefit is if we do have mental health issues in the community and it's not necessarily a homeless person, that the expectation is that she would either co-response or however it works, be able to do that assessment. And I know she doesn't work 24/7. But during those hours of operation,
I think part of the issue and I can certainly try my best to find those numbers. I think part of the issue is some of them go straight to PD. So we're not getting those phone calls, and yes, we're partnering very closely with the PACE team.
Would they divert them to mobile crisis?
Yeah, and then they divert them to mobile crisis at 988 from there. So that's going through, and is it Slaughter down here too? Like it was in Oklahoma City, yeah. So so it might be hard for us to try to get those numbers, but that's something I can certainly inquire about.
Yeah, I'm just thinking about Shannon Hanchett, obviously, the AT&T store. So just thinking about a call like that coming in, it probably would have been better served to have a mental health professional. So, Councilmember Bruce, I saw your hand.
Yeah, so in my mind, Kara, her function, her role, I can see doing the tactical for a while, but I also see it in the long term that it would be the city interfacing with all the nonprofits related to, hey, this is the gold standard when it comes to case management. And you facilitate bringing their case management program along. Is that the long-term intent?
Not necessarily, because again, I can't tell agencies what they need to do for case management. I'm not running the agency, I'm not their boss. Obviously, I think if somebody's doing it well, I would hope other agencies maybe follow suit, but again, that's not necessarily my role to have them do.
I don't see the city being the lifter for case management. We can create the environment for that to happen, and help assist, but to be the belly button for case management, that would be like, what? To me, why? If that's the direction we're going, we can talk about that sometime.
Are there any more questions for Amanda?
Thank you for everything.
You're welcome. Excited to be here.
Thank you to Care for everything.
Yeah, it's been a long time coming,
Appreciate you very, very much. You should have asked for your hair coloring to be added into your salary though.
Oh, I want a reduction.
But that's what our clients know you as, now it's job related.
All right, keeping an eye on time because there's a planning commission meeting coming up too. So item 3 is update on the Cleveland County Home-Based Action Plan and discussion on best practices for managed encampments. And I'd like to recognize Heidi Smith with the COC to present.
Hello. Not to take credit for city staff work, but I made both of them apply for their job, so you're welcome. Yep. I was there on the phone like, applications are open.
2 feathers.
I do. So I'm back with the home-based plan. This is, I don't know, 4th, 18th. No, it's like the 4th time I've updated the plan. So for those of you who are not aware, one of Lee Hall and my absolute favorite thing is when somebody says, if we just had a plan. We don't have a plan. And I'm like, we have a plan. So in 2020, 2021, the city commissioned a study by Homebase, paid in the $100,000 range for it, or a little over. And they came back to us, they did dialogues within the community, they came and they assessed, and they came out with the home-based plan, and the implementation plan is part of that. It was presented in February of 2022, which is just about right when the collaborative applicant position moved, like the month that the collaborative applicant position moved from the city of Norman to Thunderbird Clubhouse. So this plan and I are great friends. I have read it many, many times. So I updated it the first time, I think in '24. Or just came and talked about it. We did an actual physical update, and anything that's in blue was done in October 25. We call that version 2.1. And then today, because I'm not going to sit here and read this document to you because nobody wants that to happen, anything that you see in red is an update that is current as of June of 2026. One of the biggest things that happened in the October 2025 update, while we call it version 2.1, without actually revising the home-based study, we worked on some prioritizations. That was done by a group called, it started from two separate groups. One, Lee Hall, she is small but mighty, came to me and said, we need to get a group together to talk about the whole home-based plan, what the prioritization should be, and how do we update it. So we started with a group of, I want to say 8 or 10 people from many different areas. Kara Fritz was one of those people. And did the first revision and prioritization. In that, we moved some things, and those are on one of the back pages that were things that don't really apply to our place, or something that's so long-term we wouldn't be able to do. And then in October, we updated, like, this is where we are with these steps. If you want to turn to page, so we have Homeless Coalition, and then last summer, the Xenia group, they do community conversations. They did community conversations around homelessness. I think there were 7 of them over the summer. That group did prioritizations. We have basically merged those 2 groups into a group that we lovingly refer to as Home Together Norman. It is currently chaired by Dan Strawn. I'm retired. He has committed to doing it for at least a year, and then he really is gonna retire someday. Not if I have anything to say about it, but you know. So the prioritization of the Homeless Coalition and the prioritization of Xenia were identical when we went in and pulled the actual action steps from the Home Place implementation plan. So on page 4, you'll see the goals. They were identified in order of prioritization. In the actual document, they are highlighted in yellow. I would just like to say that one of the frustrations of this work is because you're dealing with human lives and you really can never do enough, we never stop and celebrate the victories. We have moved the needle on homelessness in Norman since 2022. There are major things that have been done, spearheaded by the city of Norman, helped funding by the city of Norman, that we are moving the needle on this. So Crimson Flats, low income to affordable housing. That was Norman Housing Authority, which is kind of part of the city of Norman, and Lisa Craig from Grants Management, and a LIHTC project that by all accounts, I don't know how they got a LIHTC project on the first ask. That doesn't happen. So we have 90 units, I can never remember which. 75 units. 90 in my brain, 75 units of affordable housing and low income affordable housing being built in our community. That hasn't happened in decades. Yay. We're moving the needle. The SRO that will be built directly out my window from Thunderbird Clubhouse. Yay. This is for the highest need. It's the only congregate permanent supportive housing system we'll have in Norman. 13 people that are chronically homeless. These are the population that it's the absolute hardest to serve. We're moving the needle on that. Quickly? No, but these are not quick projects. These are not short-term wins. Permanent shelter, the highest priority from this plan was
trying to figure out how to do permanent shelter in Norman. And in April, with the work of you guys and Home Together doing a Get Out the Vote campaign, we passed permanent shelter in Norman. That was after literal years of trying to find something and people in the city of Norman not giving up and finding a location and being able to purchase the land and then getting that before the community and getting a yes vote. We got to celebrate that for all of 15 minutes in one Home Together meeting before somebody was like, by the way, and I'm like, I hate you a little in my heart. Like, I just want 3 days. 3 days where we're like, we're doing it. But we are doing it. Our city is doing it. Outreach from the city of Norman. Do I believe that outreach should be the job of city of Norman? No, but the Norman Police Department desperately needed a point of contact case manager so that cops didn't have to be case managers. So they saw a need, found the grant, wrote it, and got the money so that the city of Norman police department, Lee McWhorter, who, by the way, is a rock star. He is phenomenal. We have phenomenal service providers here in our city. So with Kara's position, we effectively doubled outreach in the city of Norman. Because we had one person before and now we have two. Is that enough? Huh? Yeah, because she counts as 2 or 4 people. We haven't said yet. But we're moving the needle. One of the things that people have said is we need to be communicating better. We need to be integrating better. So Home Together Norman comes around, which is a group of volunteers. Some of us are paid to do the work and some of them are not. But because that happens, then you see movement, and now we've doubled outreach and we have identified that as a priority in our community and we're moving the needle. Pop-up shelter this week. That is directly an effect of Home Together Norman last year starting to talk about like, hey, do we have an inclement weather plan? And us going, that would be an excellent idea. And we didn't accomplish it in time for inclement weather last year, but at the very last Home Together meeting, which was 2 weeks ago, Lee Hall is like, if y'all want me to shut up, I will. But I really think that we need to keep on the ball for inclement weather. We have a solution. It just we couldn't get it logistically worked out. But I really feel like this is something we can do. And we're all like, you do it, Lee. And then this week on Monday, hey, look, this thing that we had started last year talking about inclement weather, we did. In 3 or 4 hours of people who are doing the work and know what they're doing, collaborating quickly and efficiently together. That's 3, like 4 of these are miracles. Like, they don't happen. And our city is doing them. And so often, instead of saying, hey, we have a plan, let's look at where we are and let's acknowledge that when people who are professionals and who know what they're doing collaborate with everybody, then we actually move the needle and we actually make change. And there is policy that can be built and funding that can be found around those changes. We have had, I will include myself in this, we have had in Norman the compunction to build the plane while we're flying it on services. It's a remarkably bad idea. It's a remarkably bad idea. I've been in nonprofit services. This is my 25th year. I've been doing this stuff a long time. And I understand the drive to meet need. I look at people. I had to tell somebody during Operation Safe, I think your tent's gone. You know, I'm one of the people that is face to face with people every day. And I desperately want to help them. I desperately don't want to give hard answers. Like, I don't have the resources. I can't let you pitch your tent behind Thunderbird Clubhouse, because if I let you pitch your tent behind Thunderbird Clubhouse, I would have to let everybody pitch their tent behind Thunderbird Clubhouse, and then we would have 45 tents behind Thunderbird Clubhouse, and that would be a problem. We have to make measured decisions based on data and evidence-driven practices. That's what this plan is. So Norman, Home Together Norman, our next two priorities, community education, inclement weather shelter. People working together, finding solutions that have stability attached with them. We have to stop pretending that our hair is on fire because somebody is in a hard place. We have to have measured and reasonable solutions. One of the things that has been said here is this is not a municipality problem. This is not a City of Norman problem. This is a national problem based on bad federal public and bad state public policy for decades. And to expect the City of Norman to solve it, and there is no solution. I trot out once again the streets guy. It's not a problem. Problems have solutions. Everybody wants the silver bullet. If there were one, there were a lot of smart people who have been doing this work for decades. They would have found it. It's a predicament. It's something that has to be managed. And we're managing it with a huge deficit in resources. Do we need more case management? You bet. But DMH took a 20% cut last year. That's case managers. Agencies that are funded by DMH, mine is one of them, 20% cut in contracts. And asking agencies to do more when they're already operating on less is a risky proposition. That being said, when I run CCM, coordinated case management, which we do over Zoom, and somebody says off the by name list, they're housed, I say, yay, we love housing, and I make everybody clap. Because we have to be able to celebrate the wins. And I think that in our drive to help everyone, in our drive to do the best, we have forgotten to celebrate the wins. And specifically around homelessness in Norman. City Care, taking over the shelter, win. Also, I'm the one that called them first. You're welcome. You got that meeting because I'd already met with Sean Lloyd. No, I'm just kidding. So.
I was going to ask too, with these, this updated home-based study action plan, that's gonna also hit the same website where we do
Yes,
updates.
I will. I don't spell well, so I try not to send something out until at least one other person has spell checked it, and then I didn't get it to Lee Hall on a timely basis. So as soon as I get back a copy that I am confident doesn't have form spelled as from, I will email that out to all you guys and get it over to the city to get on their website.
Perfect, combat you guys don't have a plan, it's always great. I mean, the OG is up there and there might be some other updates, but
Yeah.
say, here's the next iteration of it. Councilmember Dixon.
Thank you. I was just gonna say, thank you so much for thanking the city for what the city has been doing. I do hear a lot of like, city's doing nothing, council's doing nothing. It's like, oh my goodness, like,
Yeah.
we're trying, like.
I'm the city's biggest backer. When people say stuff like that to me, my first response is, if you knew what the city of Tulsa and the city of Oklahoma City provides, that dollar-wise, not percentage, and they, I'm sure, have slightly larger budgets than the city of Norman, and a slightly larger problem, like 10 times bigger problem. We dollar-wise beat them by a multiple of 5. So the city paying for shelter, cities don't do that. Cities in California do that, but cities in Oklahoma don't do that. The city is the front runner in the work. The city pays for me to do what I do. I mean, not to say that I'm like all that and a crust of bread, but I'm pretty passionate and work pretty hard to try to make the systems work. And I can do that because the city of Norman gives a grant to Thunderbird Clubhouse to help pay me. It's a huge deal what the city does. And it's easy to look at a problem and say, is it enough? And the answer to that, until everybody is housed, is no, it's not enough. And yes, it's people's lives and it's devastating, but it doesn't mean that there's not good work happening and that it's not fast, but it's slow and it's incremental and it marches forward. And we're doing it. This little dot in the middle of Oklahoma is doing it and doing it well. And I'm not talking about me, because I don't consider what I do hard. I'm an administrator. I sit in a chair. But I work with a lot of case managers who are doing work that is devastatingly difficult on both ends. They get it from both sides. They're dealing with a population that can be phenomenally difficult to deal with. And they're dealing with people on the other side saying, well, why don't you just do your job? Why don't you do more? Those are the people that when we have conversations about like, you don't have a plan, you're not doing enough, and I just want to stand up and be all like, why don't you come say that to my face?
And then I was also just gonna say that I'm super glad to hear that Lee Hall has started working on this kind of stuff.
Can't see her, but she's back here.
No, she's been doing yeoman's work for the better part of a decade, and this Presbyterian Church thing, I think there were a lot of hands involved, but I know she has been just working on that. I think we spoke about it probably about this time last year, give or take a few months. I just can't thank her enough for everything she does, and everyone in this room that's a legit part of helping. So just thank you.
Any other thoughts on the action plan before we move to, yes, Mayor Holman?
Just along those same lines too, just everyone remembering that Norman is not a city that is in stasis of population, and we're definitely not declining in population. So I often hear folks say, well, there wasn't this many people 30 years ago, homelessness, or even in the last 6 years, but Norman's population continues to grow every year. The metro population continues to grow every year. And sometimes feel like folks forget that, well, Norman has added 50,000 more people since 1996. And we've added 20,000+ people since 2010. And we, so adding more, we're getting people, we're showing it, people are coming into the shelter and are getting out of it. We're getting people through these systems and out, but we're also growing as a city too, and there's going to always be new people here, whether they're Norman residents that become homeless or people that end up here for whatever reason. So I just always try to encourage people to remember we're not stuck at the size we are. We're continuing to add people to the city every day that are moving here and things like that. So it's always going to be there unless something drastically, systematically changes at a nationwide level, I think, so.
So if that's it on the action plan, we can pivot into managed encampments, which I just want to preface this discussion with, I've heard from city staff and people who work in the COC that an expansion on the shelter makes the most sense, especially when we are talking about case management and having that on site and available for people. I believe incrementally we will get there. But until then, this talk of managed encampments it bubbles up from the community because we recognize that chasing people place to place does not provide them stability, nor that frequent contact with the outreach workers or their case management, depending where they're at in their homeless journey. So I'm gonna turn it back over to you, Heidi, and you tell us about best practices.
It's hard. Sanctioned encampments are hard.
And expensive.
Yes. There is not consensus in the COC over sanctioned encampments. Let me start there. So a lot of what you're going to hear from me, I've been reading about this since 2024. I've been looking at it. I was looking at numbers again today. I personally, with the knowledge that I have gained, sanctioned encampments make me very, very, very uncomfortable. They are not endorsed at a national level. There is the National Alliance on Ending Homelessness, national housing agencies. No one says they're a good idea. Having said that, I also recognize that Home Together Norman, we often say that 2026 is the year of the least terrible idea. We're not even looking for good ideas. We're not looking for decent ideas. We're just trying to find the least terrible one. It's not opening up a piece of property and allowing people to put tents there. You have to have at minimum, bare minimum, running potable water, hygiene facilities. You have to have showers. You have to have laundry. You have to have food, hopefully, and you have to have security, and you have to have case management. And all of those things are incredibly expensive. The security alone. So they are not, it's not a utopic yard where all of a sudden somebody puts up a tent and they've governed themselves and all the problems are done.
Yeah.
They are programs that have to be run and best practice. And I would just like to refer back to the city of Norman, as we have, decided to build things while flying them, did a shelter, and that did not work out well until we found an operator that knew what they were doing. My biggest thing is without an operator who has done this before, and I'm not even sure you can really do it legally in Oklahoma because California has way different zoning requirements and things like that. And as brutal as our state cracks down on anything that it doesn't like and passes legislation to stop things at a city level that it doesn't like, I think you would have massive problems with keeping it in operation. It is always meant to be a short-term solution. If it is a homeless encampment, from what I've read and looking at different cities in California, the 1 and 2 layer, which some information came about, that was specifically because they were building a permanent shelter and they needed a transitional place until the permanent shelter was built because it was along a railroad track and they had 14 people die and they, as a community, that's not okay. So we're gonna do a short-term interim solution until permanent shelter is built. The other encampments that I've read about that tend to be more long-term are for the working poor. It's in places where housing is not affordable. These are people with incomes. These are not the chronically homeless, and typically, it's not a monolith, but typically people who are experiencing chronic homelessness are either unwilling, but mostly are unable to cooperate in housing systems as they exist in our country right now. Other encampments or other safe parking are the working poor who have been priced out of affordable housing. And they maybe had a bill come due, or they got sick and lost their job because they didn't have paid time off, or they needed an auto repair. So they put people like that in encampment. I don't mean to say people like that, but people who are more stable, people who can operate in housing systems as they exist, as a short-term solution until they can reestablish stable housing. They're two different things. You have to decide which you're doing. And it needs somebody who knows what they're doing. And even the Tulare, I watched a video and it kind of presented both sides. And the last half of that video, I was like, oh, I would not put that on the video. I would not let that guy speak ever. But it's just it's a population with a whole lot of barriers. And one of the biggest issues is most people who are in encampments are there because they don't function well in groups or crowds. They aren't able to. And any kind of encampment, to get the number of people you're gonna need to do that, people are this far apart. And there's no privacy, there's no ability to be separated from people. Unless you buy huge acreage, which I don't know where you could get, that would still be close enough that people could access services, that they could put tents far enough apart. I mean, it just becomes logistical problem after logistical problem beyond the operator and beyond the $1.2 million cost, which I saw the spreadsheets, I saw some of those numbers. they were getting security at $37 an hour. If you put one person, like, when I broke out the math and they're saying this person, it was like $18,500 for security for the year, under $20,000 for security for a 24-hour encampment. I'm like, I would like to know how they're pulling that off. The only thing I can figure is maybe they're getting in-kind services from somebody that wasn't listed on a budget. But there are just some really, not to mention the initial investment of someplace with water and all of those things, like you would imagine at a KOA campground, electricity. What about pets? There's just so many things without an operator that knows what they're doing. And the government, if you can find a social service provider who wants to do it, fine, figure it out. But I would warn anybody, it's a really bad year to start a nonprofit that needs $1 million that doesn't have any state or federal funding associated with it.
And I would say for that community, they had access to FEMA funds, which I already asked. We do not have an emergency that we can still access FEMA funds for.
Yeah.
So,
The $18,000 for securities per month, not per year, just to.
oh, you talked to them, yes, yeah. Okay, so challenges, barriers, an operator, you need all of this infrastructure, and the question becomes which population, working poor or chronically unhoused, and then the space to actually do that work
And
effectively.
I'm going to tell you right now, you can't make Kara do it.
Yeah.
You can't make Kara and Amanda do it. It has to be a whole nother thing, a whole nother entity that is developed, that has its own budget and its own infrastructure and its own administration to make it workable. Or people are gonna die.
And I would just chime in too, I mean, essentially it's an outdoor shelter, like, let's just call it what it is. You would need a shelter operator to, at a minimum, be able to function it. I can't speak for shelters, for the agencies, but I imagine none of them are gonna go for it. That's just my thought, because of the risks that Heidi has already listed. And again, there's no evidence-based data behind a sanctioned encampment. It's not moving towards housing, it's just maintaining what is already happening, essentially. Because like Heidi said, a lot of people that are in encampments are not ones that are functioning in systems right now. When we went down to the river the past couple weeks, some people had income, and we even talked about, why not go to Lake Thunderbird then? Like, if you want to camp, like, go pay to go camp at Lake Thunderbird. They didn't want to follow the rules of Lake Thunderbird. We've heard that several times. So I don't know if having a sanctioned encampment is necessarily the best thing, because one, are they gonna go? Are they gonna follow the rules? I think some would go, but I think a vast majority won't, because they wanna be by themselves. Or maybe just be with like one other person, and that's pretty much it. So I do think it's a huge risk, and I don't think that's something that necessarily Kara and I can tackle. It would have to be an outside operator, and I don't see that happening here in Oklahoma.
Gotcha. Councilmember Gandisberry?
Yeah, one thing, when we had the encampment situation going on, Karen, Lee McQuarters, and a lot of other people were out there talking to individuals served, and you asked, hey, if we build you the great shelter, are you coming? And the response to them always is, no, I don't like rules. I don't like to be told when I have to come in, what I can bring or not, who I can bring or not. And I think that if you make a one encampment that's ran by a provider, there's still going to be all those things that make them where they want to be outside of that. And for certain clients that I deal with in my regular job and everything like that, they like to be what they call literally off the grid. They don't want nobody to know where they are. They work their angle and survive their life in the background, and that's what they enjoy. And there's something that's happened in their life that's forced that to happen to them. And so you're always going to have that population still that, and then, I think that if we do look at a model such as the one in California, we got to remember that it's in California where homeless things are supported by their government and given money by their government and stuff like that, where it's, all the resources help homeless encampments there, where it's completely opposite here. So that could be hard?
I will say in August, we are planning to talk to the city of Tulare, and we can ask them, get into the weeds, but I don't think by any means we're doing an RFP for an operator, much less have any place identified. I will say I've been contacted by a former indigent attorney about a MASH style encampment. I've been contacted by a downtown business, and actually he lives in downtown, about a potential temporary building in the parking lot of the central library, which I don't think city staff would love, so.
Now, there is some, like, I've heard this week some talk about a different, that would not be an encampment. That specific
The temporary
building that you're
building,
talking about would
yes.
actually be like, I've taken it to calling it Kirby's tent
Yeah.
in honor of Trey Kirby because he wanted a circus tent, but that would not be an encampment. That would be an actual
Extra shelter.
extra shelter. That would actually be shelter. Now, it's still outside in Oklahoma in tornado weather, so there's some questions, but that is not this.
Yeah. Well, we can definitely explore that other option as those of us who are working on it continue discussions with staff. Mayor Holman?
Yeah, the part about maintaining, that is part of the issue that the struggle that we're having is that the encampments exist, regardless of whether
Yeah.
we sanction them or not. And we just keep having this endless break them up, and then they're gone for a little while, and we break them up again. And then, like I've said before in some meetings, I assume there's someone camping in any wooded area. In the Norman and the whole metro area, it may not be a big encampment of people, but I assume that any wooded area that's hidden enough has got somebody in there camping out.
I would think that is a very logical assumption.
And that most of them probably aren't going to come to a sanctioned campground. But that's what we've been struggling with is this breaking them up over and over again clearly isn't working. And it's stressful for the people that are having to be displaced. It's stressful for us as elected officials to keep having to make decisions about what to do or not do. I'm pretty sure it's stressful for the police department to be doing that too, and stressful for service providers. It's just a big problem for everybody, and it isn't sustainable. And I agree, a sanctioned campground may not be that answer, but that's where we've led to this conversation, is that we just keep doing the same thing and it's not doing anything, and
But
we're having
once
them
again,
already. And
that's not a Norman problem.
Right.
That is a Oklahoma and the United States problem. It feels much bigger here because for some reason, this is like the political football of all time. It's stunning how much we talk about the issue here. And I recognize that people are passionate about it, and I don't love it, but there is no place legal in Oklahoma to camp.
It's an easy one to make people afraid of and angry about. And for a lot of political strategists, that's like all you need to do is give something for people to be afraid of and or mad about, and you will maybe get elected to office.
So, but as Councilwoman Grammersbury said, you're not gonna solve, even an encampment, you're still going to have people who have no legal place to be. That becomes really an enforcement issue. And if they're on county land or if they're on city land, what the enforcement of that is, because the system as it exists, that's always going to exist. So it becomes, and with Grants Pass, that changed the enforcement from the Supreme Court down. And it's just some systemic and system-wide things that have changed. The system itself hasn't changed. Encampments have been come up, been broken up, come up, been broken up for decades. It's just the ability to arrest people now that has really changed. It's the ability for places that are not as friendly as Norman, Oklahoma, to do some really impressively awful things, like concentration camp looking like things that are coming out of the state of Utah, forced work camps. That's really what has changed. We want to make sure it never hits our community. But these are not, it's not a solvable problem. And we take focus away from things we can do and solvable things and solutions that will work to continually chase after things that we can't fix. And it's awful. It's awful.
I think it's just like the constant chasing of crisis too, and that's where I feel like Oklahoma has been stuck, not just on this solution, but even like specifically with the Department of Mental Health. Like a big focus over the past 5 years is crisis. URCs, let's get more inpatient facilities, all of these things, these short-term stays, but what do you do after the crisis? Where is the more outpatient services? Where is the longevity to make sure these people aren't re-entering again? And I think that if we focus on more the long term, these issues of the encampments and things of that nature, I think will start to go down. But if we keep just chasing our tail after the crisis, we're not gonna make progress on the long-term things because we're just chasing one crisis after another. So again, like Heidi said, if we're focusing on the long term, let's focus on more affordable housing. Let's focus on maybe some prevention funds, some diversion funds, all of those things. We will see those encampment numbers go down at some point. It's not gonna be at the snap of a finger or by tomorrow or even next year. This is a long-term plan. This is a long-term solution, and it's gonna take a while to see those numbers go down. But they will go down if it's strategic and thinking about the end goal of let's get more housing for these folks.
And more types of housing.
Yes, more types, yeah.
I do know that in chasing the encampment situation, that had slowed down staff time on working on the permanent supportive housing. That was a fallout that I got told about. So anyways, I think we'll continue to talk about this in oversight and potentially other meetings. But I appreciate the feedback. Councilmember Bruce, I see you have a question.
Just in deep, but so on the shelter, you know, I'm gonna just echo in here that even though it's probably not appropriate, you don't have enough land. You just don't have enough space.
Manage encampments.
Well, at the shelter area, you just don't have enough space.
Oh,
That's
the
a
current
campus.
shelter.
Yeah, it's well, the future shelter off Reed Street,
Okay,
you don't have enough space.
right.
Even food
Food and shelter.
Food and shelter, and then there's just not enough space. There's not enough space.
Agreed, and I think that is why many of us have said that, yes, Salvation Army should be able to build shelter. I know that even if we
I'm
have
not saying
two,
shelter space, I'm just a room, because sometimes you like to be alone, right?
Yeah.
You wanna walk out of, and be alone, be alone, where you can walk 25 yards and not have anyone around you. Does that make sense?
Yeah.
I'm just saying, I don't think everybody who is forced to be outside right now wants to be outside if there is an option for inside, which that would be some shelter space. I hear you on people who might wanna camp and be by themselves. But just thinking holistically, even with this new shelter, it is not gonna address everybody who wants to come inside. But I want to ask a little bit too about we're hearing potentially 35 beds if we were to expand that shelter. What does that mean when we're talking about these encampments? I know it's not a huge dent, but
City Care has a waiting list. So you're gonna have some people that it's gonna address the immediate need, and I don't know what their waiting list is. I'm assuming 10 to 15 people a night?
yeah, would you speak on that, Sean?
Yeah, we usually have roughly 8 to 15 turnaways every day. They do manage a list of people, but the list usually holds quite a few, 40, 50 people at all times.
So it's just gonna, it's one of those, the variables, like if that had with the new shelter, a kennel, that solves problems for a lot, there's some
Yes.
things, some amenity things that will make a huge difference numbers wise. Are you gonna fill the beds? Yeah. You put
And we did
35 or
talk-
50 additional beds, you're gonna fill them because we have the unmet need in our community.
And we did talk about putting not a whole bunch of kennels, but a touch, whatever that is, a small number of kennels could go in an
7
expansion.
to 8, what Joe Carter was mentioning.
7 to 8.
I would think an expansion at the shelter, what you're really gonna see is people who are willing to come in for some periods of time. You're probably, people who are really wanting long-term shelter have probably already gotten a shelter bed, and they're probably represented in that community of 21 to 40 people who are long-term stayers at the shelter. That's just a guess. That is not data-driven. That would be my assumption based on a year plus of them having a wait list and having long-term stayers. But once again, it's just, you never know when a person is gonna decide, yeah, now is my time. I'm gonna go for it this time. Or, it's been years since I've tried to operate within the system. Maybe I can do it this time. Or they have a situation change or whatever. It's just so hard to know why an individual chooses not to be in shelter that wants to be, that's not on a waiting list. Does that make sense?
Yes.
It speaks to, like, and I know I said this before, not that being homeless is uncomfortable, like, we all know that. Living in a tent is uncomfortable, but how uncomfortable are they to finally go into shelter if there's a bed available? That's the other aspect too. Like, we can't judge when that time is. We don't know when somebody is ready, just like for treatment for substance use.
Those that want to be off the grid alone, but I'm also thinking there are people in communities that are together when they're camping, and so some of that, a part of the equation might be like, is there enough for a group of them to go together?
Yeah, because it's a comfort thing. It's just like the folks that have dogs, like that's their companion, that's their comfort. It's the same thing in encampments. You may have maybe a couple people off by themselves, but also you have a little group here and there of 2 to 3, 5 people, whatever that may be. That's their people, that's their comfort. And one of them may be ready, but they may not be willing to leave because the other 3 or 4 are not ready to leave. And that will hold them back. And the chances of you getting all 5 of those people ready at the same time, I feel like are pretty slim,
Okay,
honestly.
good to know. Councilmember Gandasberry.
Another thing I, worry about and everything is, we're just now starting to get to summertime, and Lord forbid if we have a very, very extremely hot summer this year, when you got everybody kind of intense and things like that, we gotta worry about health concerns there. That would help people probably want to come into a shelter more, even those that didn't initially want to, just like they do in wintertime. You get a higher spike, than you do on your nicer days and everything. So that's something that we're gonna have to deal with in the next couple of months and everything is that too. So,
Or it's kind of humid now.
I'm just saying it's gonna get worse.
Yeah, it is. Mayor
It's
Holman.
uncomfortable now. for
Just
sure.
on that same note, I've said it many times, like, traveled all across the country, and this is literally one of the last places, if I were choosing to be homeless, this is one of the last places in the United States that I would want to be homeless in the state of Oklahoma. I just spent several days in a part of the country where it's 80 degrees almost every day all year round with zero humidity, and they have a homeless issue there. But if I were choosing, that is exactly where I'd want to be.
If you were my favorite term, the homelessness lifestyle.
Yes. But in Oklahoma, where it can be over 100 in the summer with 90 plus degrees in the middle of the night at 3 a.m. with humidity, and then below zero in the wintertime sometimes, and then softball size hail, high winds, tornadoes, unpredictable severe weather. This is literally just throw the politics of the state out the window. The weather in Oklahoma would be a deal breaker. I would just get on my feet and start walking out of this place.
And in a state that provides no resource, then you have.
I at least want to be outside somewhere where it's nice to be outside.
You want to be outside. Outside is not actively trying to kill you.
Yeah, so I feel like you'd have to either have
community or support.
Yeah, I question the sound mindedness of someone who would tell me, yeah, I want to be homeless outside in Norman, Oklahoma. I would be concerned about their capacity at that point, because I'd be like, to me, no rational person would want to live outside in Norman, Oklahoma.
The only people that I
That's just me.
have ever heard of that want the homelessness lifestyle are people who like climb mountains, or they're avid outdoors people who live in vans set up for that,
On the
because
beach, yeah.
I can't live in Vail because I can't afford to, but I want to ski, so I'm gonna live in my van, or I want to climb El Capitan and I can't afford to live that and pay for an apartment. So there are some people who actually have a lifestyle around homelessness, but they're action adventure people who, you know, they can't have their feet nailed to the ground. They want to, you know, drive the country, but they also have income and they have,
Yeah, I would
you
say
know.
nomadic lifestyle.
Right.
And definitely those van life people, they are influencers in their own realm and do earn quite a bit of money, so.
Say it's one of those people.
I would just like to say one more thing. We have a case manager training at the end of July every year. We get a fun t-shirt that says "in homelessness" somewhere. And I was gonna try to score you all some t-shirts. But yeah, no, I looked at the budget, but we can have a nice OK 504 Continuum of Care pin swag. It has a little fidget, feels really nice, so there you go.
She only can give that to us because Dixon left.
I brought 10 and I don't wanna walk home with any. So everybody up to 10 people can have a pin.
So that's a no on the shirt then.
That's a no on the shirt.
All right, seeing no further questions or comments, thank you, Heidi, for presenting. And I'm gonna call this meeting adjourned.